Hello, everyone. Um, Good day. Okay, all right, great. Welcome. Hi, good day. So today, we're talking about our topic of the month. So our topic for the month of April. I know we're already in May, but we couldn't have a Instagram live session for. Yes. Hi, Dr. Kendall. Please, you can just request to join the live. So, we had not had a topic of the month Instagram live session for April, which was substance or drug use, and that is what we are having right now. And we have our guest speaker, Dr. Kendall, who would come on live shortly with us, and this would be a really fast Instagram live. So what that means is time. We'll do maybe some 30 minutes to 40 minutes and we're done and we can get on with our day. So Dr. Kendall is here and she's joining. Hi.
Hi, how are you?
I am very fine, thank you. How are you?
I'm doing good, thank you.
All right. So I'm going to let Dr. Kendall introduce herself. I'm sure a lot of us have read her profile earlier on when it was posted on the group, on the on our Instagram timeline. Sorry. So again, my name is Sandra, and I am the founder of Psychebabble Foundation. So Dr. Kendall, please introduce yourself to all.
Sure, so thank you so much for this collaboration and for having me today. My name is Dr. Kendall Morris, and I am currently in Michigan, in the Detroit area, and I'm finishing, well, actually, I am finished. I'll be graduating in a few weeks with my PhD in social work from Boston University. And my research focuses on the impact of trauma and community violence in Black neighborhoods. But right now, I'm doing some work at an organization in the city of Detroit called the National Council on Alcoholism and Drug Dependence, Greater Detroit area. And so that's why I'm on this call today, because the work that I do focuses heavily on really prevention, so preventing youth and young adults from engaging in underage alcohol use and also use of different substances. And so um, we know that this is a huge issue that's going on right now with substance use among young people. And so that's why I'm on this call today to talk with you about it. And thank you again for having me.
Pleasure. So, if anything, in fact, I feel like you're the right person to be on this call with, so you can do all the justice to this topic because a lot of people still, despite how much effect or how much impact the substance use is causing in our community, especially young people, somehow in the Black community we still see it as it's not such a big deal. A lot of people still see that it's not such a big deal, but this thing it is a big deal, right? It's an issue. So so I read something. I had done a course on drug use prevention as well, and they had mentioned something about age of initiation, right? So the age of initiation for substances, as much I think UNODC, United Nations Office on Drugs and Crime, is trying to reduce that to as low as possible. However, somehow in my country, Nigeria here, research has it that the age of initiation is as low as even 5 years old, and some even lower. So we just have that. That's what research can get at the moment. But
Mhm.
from people who are living in some communities, they feel like it's so much lower. What do you have to say about that?
Well, yeah, I think that some of the statistics for, here in the can be as young as, oh no, go ahead. I think you did come out, but you're back in. I was just saying that the age of initiation for in terms of in the United States, it may not be as low as 5, but we're definitely, but that's just based on, because I'm sure all the data hasn't been collected, but we have young people who definitely are being exposed to substances at uh, much younger ages. So definitely, it could be in elementary school, really in that middle school age range. And I think that is why it's so important for us to be talking about this topic, number one, and number two, for us to be doing this prevention work. We have to be able to talk to young people about these issues, and because, as you just mentioned, in your country, the age is as young as 5, and so I mean, it's not shocking to me, because a lot of the things that we talk about even here at this agency is that for youth and young people, at least, they are heavily influenced by their family members, friends, and peers. And so if there are family members within their home who may be also using these different substances, that's why you see, the age being so low. So I definitely think that, you know, um, that is one of the reasons why we do the work that we do, and we focus and target heavily on young people,
Sure.
because it's important to educate them about the issues that are going on as at a young age, in a way that they can understand, and maybe, by touching them at certain touch points in their development, it'll help them understand the dangers of being using these substances. But hearing the age 5 is shocking, but not at the same time. Mm-hmm.
Yeah. All right. So before we even dive deeper, a lot more deeper into this topic, how about we just get that out of the way? So what exactly is drug or substance use? Like, what exactly is that?
Oh yeah, I think that's a great question. So basically, when you're thinking about drug or substance use, I know the curriculum that we teach on touches on a lot of different substances. So when we're talking about drug or substance use disorder specifically, that can encompass a wide range of things. So when we talk about substance use disorder specifically, or SUD, which is a common acronym that's used in the United States, it's actually seen as a mental disorder that affects a person's brain and behavior, leading to a person being unable to control their use of substances. So when it becomes an issue when it's uncontrolled use of substances. So and different types of substances can be, for example, we have alcohol, that's considered a substance, but then you also have illicit drugs. So there are a lot of different categories of drugs that I know that we teach and talk about, but things such as marijuana. We also have like e-cigarettes, vaping. Then we have other types of drugs such as cocaine, heroin. Those are all different types of substances that an individual can have issues with. So basically, if you're using it to the point where it's impacting your daily functioning, then that's when it becomes a problem.
Yeah. All right. So quick one, right? A lot of the times when I'm talking to young people and we're talking about drug use or
Mm-hmm.
substance use, and then a lot of times somebody trying to be funny would say, "Oh, that's good. I'm not in that category, or you can't, so you shouldn't be talking to me because I only take alcohol." A lot of
Mm-hmm.
people, there's this misconception that alcohol is not even a substance; it's just one of those things. It's just something. It's not a drug. It's just something.
Yes, but
So
and that
yeah.
that's a good point, because I also hear that with some of the young people as well. But it's important for people to understand that alcohol is definitely considered a substance, and it is. And the other thing is, just as we say that a lot of these drugs are addictive, so is alcohol. Alcohol can be very highly addictive as well, and just as a lot of the illicit drugs have a lot of health implications, consuming too much alcohol can also have a lot of health implications, even death. And that's something we do talk to our young people about as well. That, when you do things such as binge drinking, which is drinking a certain amount of drinks within a certain time period, and it's different for men and women, and based on some other factors. But doing things like that, that's a substance that's very highly addictive and can be just as addictive as some of the other, drugs that everyone is familiar with. So I think that's interesting that you hear that because I hear that as well. But it's important for young people
Yeah.
to understand that alcohol definitely is included in that grouping, and that I know in the United States there is a legal alcohol age at which you're supposed to be able to legally consume alcohol, which is 21. So we especially educate our youth on that because that's the legal drinking age. So not only is it dangerous to consume alcohol, but then you also don't want to be consuming it underage, because if you're caught, then there can be health implications in terms of um, being being arrested or having to do certain things, community service or whatever, being in trouble with the law because you've been consuming that. So
Yeah.
yeah, that's a very good point, and I definitely hear that a lot too. I hear that with alcohol and sometimes with marijuana as well. So,
Yeah.
but definitely alcohol.
That's interesting because I think it's important that we put that out there for a lot of people to
Yeah,
realize that truly this is um, a part of the grouping as well. It's not, or you're not just drinking just for drinking sake, right?
yeah,
It's grouped there for a reason. All right. So again, remember the training I had spoken about. So one of the things that I think, if I remember correctly, was so the adult's brain is not fully formed till sometime around the age of 21 thereabouts. So in
or
that,
it
what
could be
that means,
later. Mm-hmm.
yeah, or later. So I mean, this was a training for substance use prevention. So what they were
Mm-hmm.
trying to explain to us was the fact that if we can delay the age of initiation, because even at the age of 21, taking some of the substances have a huge impact to play on the brain, right?
Yes.
So is that fact correct?
Yes, that's correct, and that's something that I definitely teach the young people that I work with, and a lot of them get surprised when I say that. And it could be, 21,
Yeah.
even up until the age of 25, that our brains are not fully developed. And that's what I try to harp on with them is that if you put all these substances in your body and your brain is still developing, that's going to have implications on your life um, years from now. So that's why sometimes we see people or individuals who may be 45 or 50 years old, but they have the brain capacity of a teenager or or a young adult, and that's because they have placed a lot of these substances inside of their body at a dangerous rate, and now that has stunted their development and their growth, and so they're not able to. Their brain capacity is not at what it should be for someone who is a lot older. And that has a lot of negative implications for your life. I mean, we've seen
Yeah.
a lot of individuals who are struggling with these different substances. They can't keep employment for very long. They struggle with, regular basic activities that they should be able to do at that age. And so it really can, stunt your growth and development, and then your overall capacity of what you're able to do in your life because you ingested these substances at a dangerous rate early in life. And then it also, even with the messing up with your brain development, there are so many other health implications for many other parts of your body that ingesting these substances can have a negative impact on. And that's something else that I also go over with the youth all the time is that it impacts your brain, it can impact your kidneys, lungs, like everything, your whole functioning as you become older. That's why you see a lot of individuals, especially who struggle with alcohol addiction as they get older in life. You're seeing a lot of kidney failure. They're having a lot of issues with other organs that should be functioning properly, and they're not because that alcohol really does. It can poison you and impact you later in life. So I think that's a very good point. And people, like I said, a lot of times when I go over that information about the brain not developing until a lot later in life, it surprises a lot of young people.
It does. It does
Indeed.
throw a lot of
So,
people off
yeah.
balance, actually. All right,
Hmm.
that's good to know. So I know you had just mentioned some of the effects of, some of the things that these substances could cause in our body system and all of that. Could you highlight more of that, especially for the youth demographic? Like, can we highlight some of them? So speaking of what
Hmm.
exactly, how bad does the effect? How bad does it go?
That's a good question. So, how bad it can go is death, which,
Mm,
That sounds scary, but that is the reality.
True.
Especially with we've seen it out in the news with recent statistics talking about how, especially with the pandemic, a lot of those individuals who are struggling with substances, it has either been exacerbated or maybe people who are doing well have gone back to it. So the worst thing, of course, that can happen is definitely death. Over time, um, you know, ingesting all of those different substances is very harmful to your body. And then there's also with drugs and alcohol. If, for example, with drugs, we have drug overdoses. So that's people who are ingesting a lot of the drug in a short amount of
Yeah.
time, and then they end up overdosing and they may die from that. And then the same thing with alcohol. What I was talking about before with binge drinking, it can be very dangerous to drink a high amount of alcohol in a short amount of
In a short
time.
time.
And so I think in general, it's like four drinks for women and five for men in a span of a few hours. That
Mm.
can be, more or less depending on a lot of biological and physical things going on with your body, but that's basically the baseline measurement for binge drinking. And then there's always a risk of like alcohol poisoning, which again is from ingesting too much alcohol at one time, and that can also lead to death. We also, as I was talking about before, with alcohol over time, it can cause kidney failure. And the issue with that is, okay, if your kidneys do go into failure, yes, you can get your kidney replaced, but you most likely won't, because there are very strict, at least in the United States, there's very strict guidelines that they're expecting you to follow in order to be put on a kidney transplant list. So when they interview you and they ask you, what is your lifestyle, and you tell them that you are smoking or drinking a lot, then they're most likely going to deny you to get on that list for the transplant.
Mm.
So other things is that it can cause a weakened immune system. So any of these drugs or alcohols that you put in your body is going to weaken your immune system, which is going to increase your risk of illness and other infections. So anytime that we deplete our immune system, that's kind of like our body's guard and defenses that keeps us protected from getting really sick from certain viruses or illnesses. But once you put substances in your body, that kind of brings that down and really
Exactly.
weakens your immune system. Of course, we talked about the brain damage already. There can also be issues with memory, attention, decision making. These all of these substances are mood altering. They alter your perception of life. Things may become blurry or fuzzy to you. You might not understand what's real and what's not. There can be hallucinations depending on what kind of substance you're intaking.
These are the mental health impacts.
Yes, and then also physically, you can have issues with your heart over time. Um, and then that puts you at a higher risk to have heart attacks. You can also have trouble keeping other things down. So if you're ingesting a lot of these substances, then you may have like nausea, abdominal pain, or even vomiting. It's hard for you to even keep regular food down because your body is looking for the substance. And then with any of these drugs, a lot of individuals may start off with a lesser drug, and then they become more addicted, and they may graduate to something that's more harmful like a heroin or a cocaine. So that's another risk as well. You may say like, okay, I'm just going to smoke a cigarette, I'm just going to try marijuana. But when those substances become not enough for you, then you're going to try to
Progression.
graduate and progress to something that's more harmful to your body. So increased risk for becoming even more addicted is also a risk, because then that's really where um, chances of death can increase, and that's what's going on with a lot of people now. Is they're looking for they got high off of one substance, and they're trying to chase that high, but they're never going to get that original high that they had. So they're
That they
chasing it and
become
chasing it.
frustrated.
So they're looking for any type of substance to help them get that initial high that they're never going to get again. And so that puts them at risk for death, because they then end up injecting something that's pretty deadly and they weren't aware. Or even in the United States right now, there's the issue with some other, some drugs being laced with other drugs. So drugs being laced with fentanyl, and then people ingesting that and not realizing it and it killing them because they thought it was something else. So, I mean, I could go on and on and on about all the
It's a
risk
lot,
factors,
yeah.
and that was a lot alone by itself already. So I think if you're not convinced that substances are something you should stay away from, I don't know what else will. I mean, because there's,
True, true, true.
that's not even everything. That's just kind of like
A
an
brief of it.
overall laundry list, because each substance actually has specific things that happen to your body, which is something that I teach on all the time. But yeah, I mean, it's risky. And, and then we're talking about, I don't know if you were going to talk about things beyond the physical impact, but it also has an impact on the people around you. If you, as a young person, are engaging in using risky substances, you are an influence on your peers, whether you realize it or not. So if they see you engaging in that, then they may also want to engage in it, which is not good for, for both of you or for the group of people you're surrounded around. And it also has an impact on you financially. Some of these drugs are pretty expensive to come across, in the
True.
United States for sure. And, becoming addicted to them can cost you a lot of money, whether that's alcohol or other illicit drugs, or even like prescription drugs, which I didn't even touch on. That's another thing you can be addicted to. Those become expensive and pricey the more addicted you become because you're always trying to get them. And so that can have a lot of implications for people. We see a lot of people who have issues just maintaining and sustaining their lifestyles because they're trying to purchase these drugs all the time. So that's another health implication too, and it has an impact on your mental health as well.
Wow, that is an exhausting part. I don't like it's scary that people hear all of these things and still don't think it's important. You hear all of these things and you still think, oh well, I'm going to speak for myself.
Yeah.
And it's scary and it makes you just wonder, have you not been listening? Are you not seeing what's going on? But then I think that also brings us to the idea of the some of the causes, or not necessarily causes, more like factors that push people into using some of the substances. I know a lot of people, it could be just being curious. For some other people, it could be peer pressure. It could be anything at
Mm-hmm.
all. Some people also cope, like you mentioned, prescribed medications, right? For some people who have chronic illnesses, addiction could sometimes be in that scenario or in that situation. So outside all of this, what else? Like, what are some of those factors that are pushing people? Like, really, okay, this is why people are doing this. This is why someone who knows all of the side effects, all of the negative impacts of this drug, yet would still engage with it. Like, what exactly is there?
Yeah, that's a good question. I think some of it has to do with, I know with a lot of young people, for example, who use marijuana. I mean, I've asked some of them, why they use that substance, and many of them say that it helps them, function. It helps them deal with the stress. It helps them to cope with everything that's going
Yeah.
on, especially when you look at like college age young people. A lot of them are turning to substance such as marijuana because they say it's a coping mechanism, which that generation of young people, which I guess are the Gen Zers, those who were born in like the late '90s and later, have grown up in a lot of things going on, and it just seems like thing after issue keeps happening, and
Yeah.
so they say that the marijuana that they're taking calms them down, helps them to deal with and cope with everything that's going on. The other thing is that you said it already, but I wanted to highlight it because I don't know if a lot of people are aware, is that a lot of youth, especially who are teenagers, become addicted to the prescription drugs because of just what you said. A lot of them play sports at school, a good percentage of them. And if they get an injury and they require surgery or some type of procedure, the doctor is going to prescribe those opioids, those prescription synthetic drugs to help them deal with the pain.
The
And
pain. Yeah.
so those drugs are known to be, based on the data, very highly addictive. And the other issue is that they become addictive because an individual may take it for the pain, but then they like the way it feels. So once the pain goes away, they continue to take the substance. And that is a huge one for young people who are in high school who may be playing sports or had an injury. That's how it starts. And another thing that gets young people engaged in these substances is definitely peer pressure. It's, especially with social media and a lot of things being digital that these young people have access to, they're getting cell phones, they're much at a younger age, they're getting access to the internet at a younger age.
There are role
And
models on the
yeah,
internet.
so there's a lot of imaging or messages on the internet that can really be impressionable on they can be more impacted by that. And so that has a huge impact on them. And then there is some issues with family history of addiction. So if you have, individuals, adults in your family who may be addicted to different substances or drugs, those type of things can be passed on to your children. And sometimes it can either go one of two ways. The child sees that in the household and they decide they don't want to engage in that, so they don't. Or on the other hand, this is what they grew up around. So when they become older, they start, as they get older, they engage in it. So there is some of that as well. But I think the biggest one is definitely young people saying that they're going through a lot and they need to use these drugs or substances as a coping mechanism, and then also the peers and the people that are around them, and then what they're seeing on the internet. I mean, and even, we're not talking about this on this topic, but I know, for example, like gambling addiction is becoming a big thing for young people. And why? Because there are a lot of ads, which I see them all the time when I'm just watching TV, or even on Facebook ads or Instagram ads that target, different organizations like FanDuel, and they're like, you can gamble and get the first however many for free, and then that gets an addiction too. So those, I would say, are the biggest things for young people right now, is that we're in a digital age and it's a lot easier for things to be pushed in their faces
Into your face,
and it
yeah.
to be made to look like it's something cool that they should be engaging in. And so they do it. And yeah, that curiosity thing is still a big thing. But I know the biggest thing in the young people that I talk to is that they're using it as a coping mechanism, unfortunately. So, yeah.
All right. So speaking of coping mechanisms, right,
Mm-hmm.
and people who are dealing with chronic pain. So for example, I remember someone had spoken to me. So she has a sickle cell, right, and
Mm,
using she was prescribed one of these opioids for the pain. And after a while, she realized that she was becoming dependent on them, gradually moving on to addiction. So for somebody who is experiencing that much chronic pain and someone who is using this as a coping mechanism for anything else, right? How do we how do we address that? How do they get past that? Do you get what I mean? So
yes. Mm,
so for someone who, okay, great, now we understand that this is addiction. We understand that this is you getting addicted to this thing. How do we get you from here to here? How do we get you from here to this point without that drug or substance?
yes, that's a good point. Actually, because my husband actually has sickle cell anemia, and he is has been prescribed different medications to help him manage his pain. And that is one of his biggest fears, is that he is trying to stay away from becoming addicted to
Yeah.
them. So I think that it just becomes, like I said, there's different levels of pain medications that he has, and learning how to not jump to the stronger one when you may not need that one
Hmm.
is the first thing. And then learning how to use alternative methods to maybe help you cope with the pain. So maybe using like heating pads, or soaking in Epsom salt baths. And, sometimes those things may not work, but using alternative methods, and that goes for any type of substance abuse or addiction that people are struggling with, is trying to replace it with other things. And the first thing I would say, if you're already addicted, is getting help. There are a lot of organizations, a lot of 1-800 numbers. I know for the agency that I am working with, NCADD. They have a number that you can call to get help, and that's the first step is working with someone who is a professional who is trained in helping people who have substance use disorder or other type of issues with substances. There are counselors or social workers, mental health counselors, drug use counselors who are well versed in that area who can help you. So that would say the first step would be trying to get some help. And then there are also other, beyond just getting like that one on one, maybe support, there are treatment programs that you can enter into that will help you to deal with your addiction. There's also even just like support groups that you can join there. And then once you are able to not engage in substances, I know our agency also has recovery coaches, which are individuals who come in once you're in that recovery phase and kind of monitor and help you to stay that way. And we also know that relapse is a huge issue as well. A high percentage of people who are on substances and try to become clean, they do relapse. But I think the key to people who maybe have stayed clean is that you have to want to do it, and it has to be in your a mindset thing, and then making sure you keep up with supports, individuals or groups of people who can help you stay accountable, and then knowing like what your triggers are so that you can replace that with something else. So I hear some people who say that they used to have an addiction problem, that they maybe replaced that with exercise or yoga or some other type of activity that can take up their time beyond just engaging in using the substances, developing some type of life purpose so they can replace that with using substances. So, and it's not easy at all to curb the addiction once you have it. It's not easy. I mean, you can talk to plenty of people who are in recovery for however many years, and they will tell you that it is not. It's not easy at all. But if you are willing to take the steps, there are resources that can support you and help you to, be successful.
Yeah, I agree with you. And I was going to ask about, when you started with talking about the professional help that they can, like people can get for it. I was thinking, oh, okay, great. These are amazing tips. However, what about just self-help tools that you can use, right? But you've already
Mm-hmm.
covered that. This is amazing. So, again, I am going to say thank you so much for coming on. But before I let you go, I have just one last question, right?
Mm-hmm.
Sometimes it's difficult for some people to realize that they are getting to that point of addiction,
Mm-hmm.
right? So, what exactly is addiction, and how do we kind of like catch it earlier on to understand, oh,
Mm-hmm.
okay, I think I'm getting to this point and I need to catch it when I can. You know what I mean?
Yeah.
Yeah.
So I think that's a good question. And like I was saying before, it's it becomes an issue when it becomes chronic, long lasting, and like I said, it impacts your daily functioning. So I mean, I watched a couple of different documentaries about individuals who were addicted to substances, and they were talking about how they knew they were addicted once they would like wake up in the morning and they couldn't even start their day without getting that substance, whatever it is they were addicted to. That's when it's now becoming an addiction. When it's you're doing it long term, even though you know it has consequences and it's impacting your daily functioning. So you're no longer able to do those normal things that you were able to do before, like go to a job every day and work or go to school and be a student. Those type of activities that you were doing now are being impacted because you can't do anything but think about that substance. I think the way that you stop from getting to that point is to realize when just to be aware of when you notice yourself maybe starting to do things more because something you may have like been curious about or you tried it and then maybe the next week you're trying it again and the week after that you find yourself using it again. So once starts to become something that's becoming a routine or a pattern, that's when you need to stop and take a step back and say, okay, where is this going? So that that's basically what addiction is that it's impacting your daily function. That's how I look at it. When I see people who are unable to perform those basic things that they were able to do before, and then it's when it's impacting every aspect of your life. Like for example, financially, you're not able to
Yeah.
pay your bills because you have to go buy alcohol or you have to go buy this drug. a lot of people who are addicted will tell you that it took over their whole life. So they were not able to sustain
Function properly.
because they were trying to use all their money to, or they ended up doing things like stealing in order to get the money once they ran out of their own money to get the substance as well. So I think that's really what it is, and what I talked about before is the key to recognizing when you may be on that path.
All right. Thank you so much, Dr. Kendall. I mean, I think this has been really, really amazing. We'll not take questions. I don't think we have any at the moment, but I just want to say thank you so much for coming in. And in case anybody's wondering, this conversation we're having is topic of the month here at Psychebabble
Mhm.
Foundation. We usually have this conversation every once more than once actually. So we have a topic for each month, and for April, the topic was substance use. And I know we're
Mhm.
having this conversation now, but all the same, it was supposed to be for April, right? So we have these conversations just to promote to promote mental wellness, to promote these things, and let people understand that there are impacts. Mental health issues are becoming um, one of the biggest things that we are struggling with in the world, right? And it needs to be addressed as soon as possible. The more we have these conversations, we are hoping that more people get to see them, more people get to understand it, how important these things are, and actually seek help. So, again, like Dr. Kendall had said earlier, resources are available everywhere if you want them. If you're
Mhm.
in Nigeria, you can just send Psychebabble Foundation an email or a DM, direct message on Instagram, Twitter, anywhere that you find us. Send us a message and we would send you the right resource that you need, which is really, really important. And I don't know, Dr. Kendall, can you just give us like a plug for people who might be in your area?
Yes, so if you're in the state of Michigan specifically, you can call NCADD's number, and that's 313-868-1340, and someone will be able to help you and get you to the right support. We offer services for individuals in certain counties of Michigan. There's also a helpline for in general for those who may be struggling with addiction. And you can call 877 And that is a 24/7 hotline number that you can call if you are need help, whether if it's an emergency or not. Someone will be available to answer your call. So, and then you can also visit our agency's website, which is ncadd-detroit.org for more resources and support.
Right. Thank you so much for that. Oh, by the way, before you go, can you, in case someone is trying to reach you or
Mm-hmm.
try to contact you, how do they reach you? How do they contact you?
Yes, so you can message me here on Instagram. My tag is Kendall the Model Scholar. I'll put that in the chat. And then also
Perfect.
you can email me as well, and I'll put my email in the chat as well. Those are the best ways to reach me, and I will be very responsive. So I put those two things in the chat for you.
All right. Thank you so much, Doctor. So again, all of this information would be available in the caption.
Mhm.
And this Instagram live will be saved as well as hopefully would go up on our YouTube channel very soon. And you can find all of these resources there. So thank you so much again, Doctor, for coming on and honoring our invitation. I know the time difference have been,
Mhm.
a bit of an issue, but thank you so much for honoring the invitation. We really, really appreciate that. That being said, thank you guys for joining in, and we'll see you for the topic of the month in May. Thank you so much, Dr. Kendall.
Thank
Have a good
you.
day.
You too. Thank you
Bye.
so much. Bye bye.
All right. Okay, you guys. So, last but not the least, again, please look out for our events, look out for our Instagram live sessions, look out for everything that we are doing. Join this live conversation, send to your friends, send to your family members. Psychebabble Foundation is always here for your mental wellness here in Nigeria and also for Nigerians who are outside of Nigeria. All right. All the information you need will be in the caption or in the comment section of this video, and I hope you see this video. We hope you share it. We hope you like it. We hope you comment. We hope it starts a conversation for you. All right. Have a good evening, good day, wherever you are. Bye.